Okay, so we've talked a little bit about what upper motor neurons do, what lower motor neurons do, and how they work to regulate tone in the body. So now we're going to move on to what happens when you have a lesion in the upper motor neuron versus the lower motor neuron. So whenever your central nervous system or peripheral nervous system are injured, movement is affected and tone is affected. So just keep in mind that control of movement is achieved through the interaction of the four systems that we reviewed before. So the two for the upper motor neurons are the pyramidal and the extrapyramidal tract, and for the lower motor neurons is the cerebellar and peripheral nerves. So when the pyramidal tract of the upper motor neuron is affected, you end up with spasticity, which we reviewed when we were talking about tone, so high tone. When the extrapyramidal tract is affected, you end up with chorea, athetosis, or rigidity. If the cerebellar is involved, the cerebrum, you end up with ataxia. And for the lower motor neuron lesions, because this nerve travels through the anterior horn cell via the peripheral nerves, you end up with flaccidity, so a flogginess or a lack of tone. And that brings us to the chart here, where we'll review the differences between upper motor neuron lesion and lower motor neuron lesion using the acronym STORM BABY to help you remember. Okay, so S is for strength. So given what you've learned so far in the lecture, in the upper motor neuron lesion, is strength going to be increased or decreased, higher or lower? Lower. That's correct. Oh, let me get my marker. Lower. And for lower motor neuron lesion, it's not higher because they're not all opposites. It's also lower. Okay, so for both, the strength decreases or is lower. Okay, T stands for, what do you think it stands for? Tone. T stands for tone, okay? So, in the upper motor neuron lesion, the tone, is it increased, decreased? Increased. Correct. Tone is increased. And in the lower motor neuron lesion, now it's the opposite, it's decreased. Okay, O stands for others. So that is two separate things that we did talk about earlier. The other thing that you can get with the upper motor neuron lesion is clonus. Okay, so a repetitive movement where the tone is higher, lower, higher, lower, higher, lower. And in the lower motor neuron lesion, you can get fibrillations. And just remember that you cannot detect these with the naked eye. That will only show up on an EMG test. Okay? And then we're on to R, which is reflexes, or deep tendon reflexes. So if you think about how that's going to relate into the tone, for the upper motor neuron lesion, what would you see with the reflexes? Increased or decreased? That's right, it's going to be increased, right? You get increased or even unwanted reflexes, and for lower motor neuron lesion, decreased. So no reaction when you do your reflex tests for lower motor neuron lesions. And then M is for muscle mass. And what do you think for the upper motor neuron lesion? Is it going to be increased, decreased, a lot, a little bit? It's going to be decreased in both, because you see here, if strength is lower in both, that's related to your muscle mass. So you do have less muscle mass in both, only with the upper motor neuron lesion, it's only a slight loss in muscle mass. Whereas with your lower motor neuron lesion, it's going to be decreased to the point where you can say there's atrophy. So you would see a difference in those two presentations. And the last is baby for Babinski's sign. So we talked about that earlier when we were talking about tone, the Babinski's reflex. When you stroke your thumb down the ball of the foot of the patient, whether the toe is flexing, so moving up towards the patient, or extending, pointing down towards the patient. Okay, so the Babinski sign in the upper motor neuron lesion is positive. The toe goes up, and in the lower motor neuron lesion, it's negative. So the toe will point down. Okay, so that's just a little acronym to try and help you remember the difference between those two types of lesions. So now what I'm going to do is have the class, we've got 41 people, so we'll break up into about 10 groups. So there'll be groups of 4 with one group with one extra person in it. And I'm going to give you this sheet where you have the clinical feature listed here. And then what I want you to do is, based on that clinical feature, I want you to think up as a group, what is the functional status? So if you had a patient with upper extremity spasticity, what might you see in terms of how that affects their functional status, their functional ability, and then how that functional limitation affects their participation in either their self-care, productivity, or leisure activities that they might want to participate in throughout the day. So you have to use your imagination a little bit. I'll give you about 10-15 minutes to work on that, and then I'm going to ask one person from the group to present their findings. All right, get to work.